Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health, like my guest here, Lauren Mills from Valera Health. Great to see you again, Lauren.
Great to see you again, Logan.
It's really great to have these interviews over time and get to hear how the company is developing. So give me a sense of where Valera Health is today.
Absolutely. So just as a quick refresher, we are a virtual mental health clinic, and we provide therapy, medication management, and case management for the whole acuity spectrum of mental health. So from mild, moderate, depression, anxiety, stress, all the way through serious mental illness like bipolar disorder, schizophrenia. We treat ages 6 and up, so comprehensive across age groups, across diagnoses. So we are about 3 years into our clinical model. It launched pretty much in the beginning of the pandemic. Since then, we've seen huge growth, expansion of services, geographic expansion. We're in 10 states now, and our model is really based on being an in-network provider. So we can provide the most access that we can to the most people, which includes working with Medicaid, Medicare, and commercial plans.
How much did your timing play into your recent success? You said you were at the beginning of COVID, kind of rolling out the clinical model. I know you had existed for a long time before that as a company, but how much did the paradigm shift of COVID play into it?
I think it had a large impact. The growth has been, pretty fast. We went from 1 to over 300,000 visits in 3 years.
Wow.
Last month, we did about 26,000 visits in a month. So pretty rapid growth, and I think a lot of that is driven by the exacerbated need, partially caused by the pandemic, and also people leaning more on telehealth when they couldn't have as much in-person care.
Can you help us understand that number? You said 26,000 visits in a month. I know other Tele-Mental health companies have struggled. So can you help us understand just kind of the magnitude of that in the marketplace?
Sure. I think a big part of it for us is that because we're in network, it's very affordable for people. They're not paying out of pocket. They're not paying a subscription fee. They're using their benefit, and all they have to do is pay, their copay that they would typically pay any outpatient provider to access our service. But it's all remote, virtual, so it's from the comfort of their own home. Very simple to access on our app to do a video session, chat with their provider between sessions. So really the convenience factor makes it so easy for people. They don't have to travel, anywhere to get to an appointment.
I know one of the things that makes Valera unique is that you work with higher acuity patients and with children. What are some of the strategies you've employed to make that work in the virtual setting where others maybe have failed or not tried?
Yeah, absolutely. So we do a lot around engagement. We have care managers who stay in touch with people between sessions. They reach out to them if they have a no-show or they need to reschedule their appointment, make sure they're doing whatever they can to kind of keep them on track and engaged in their care. The other piece that we do is really double down on quality. So we recently, we're announcing here at Vive actually that we got our accreditation from the NCQA.
Congratulations.
Thank you. National Committee on Quality Assurance, to do our own delegated credentialing of providers. And that's a year-long process of very in-depth review of your quality and your processes. And so we passed that with flying colors. So we're really excited about that.
What's that going to mean for you going forward?
So one thing that it means is that typically health plans credential providers, which is the process of checking their qualifications, safety check. Before they treat patients, they make sure everything is in order. That can be an administrative burden on the plans and sometimes take 4, 5, 6 months. That's time that a provider could be treating a patient, but they can't yet because they're not technically credentialed with the health plan. With delegated credentialing, Valera can take on some of that work and credential in as little as 30 days in most cases. That's just faster, time to patient care, essentially. Get these providers actually working, seeing patients.
You've been growing quickly. What are your sort of next expansion plans?
Yeah. So we are continuing some geographic expansion. We're looking at states where we have anchor partnerships with large health systems, primary care groups, health plans. That's where about 70% of our referrals come from primary care and health and hospital systems. So we're very integrated into the physical health side. And then service line expansion, we just launched groups. So we're offering group therapy now in New York. And so we'll continue to expand that and grow some of our unique clinical programs such as maternal health, perinatal mental health, and child-adolescent programming.
Is there a particular area that is growing the fastest?
I would say the child-adolescent program probably is growing the fastest because, there's a lot of pediatricians out there who are seeing kids with mental health issues. Trying to treat it in primary care is difficult. They need partners to refer those kids to get care.
I'm just thinking about the human face of this challenge of not being able to access the kind of care that you need, whether you're a parent of a child with a mental health challenge or you're someone who hasn't been able to access care for cost reasons. Have you received any really meaningful stories, testimonials that really, stayed with you?
Yeah, definitely. One that definitely stayed with me was in Vermont. Vermont is one of our states where we are in network with Medicaid. And we heard from a parent of an adolescent who had Medicaid that she had been searching for a therapist for her son for 8 months and hadn't been able to find any therapist who was in network with Medicaid, available, didn't have a wait list, could treat her son. And so she was so relieved to finally realize that Valera's in network, we accept Medicaid, we're in Vermont, we could treat him, get him in services within a week. So stories like that really keep us motivated. And
how is your model of credentialing and care going to change the workforce challenges that we're seeing? I just know there are so many counties that just don't even have the medical providers that people need. So how do you see that shifting over the next, say, 5 years?
Yeah, there is a huge shortage. It's definitely an issue. One thing that can go a long way to help solve that is cross-licensing of our therapists across state lines. So if someone is a licensed clinical social worker in New York, they can potentially get their license and see patients who live in Connecticut, New Jersey, Massachusetts, New York. That's one way to really maximize the providers that are licensed and can do this work. It does take some additional work and effort to get those additional state licenses, and hopefully over time that will become easier with things like state compacts that really recognize the license across state lines.
Last question. If someone watching this interview wanted to partner with you, who would be the ideal collaborator for Valera Health?
Oh, wow. We have so many amazing partners, but I think primary care groups is really where I think we shine the most. We work really closely with PCPs who refer their patients who have behavioral health needs to Valera. We collaborate with them to ensure that the behavioral health care they're getting matches the physical health care and is all working together. And so those collaborations, I think, are really great for whole person care.
You work with private practices or groups, large groups?
Both, yeah.
Okay.
Everything from a single practitioner all the way through. One of our partners is Optum Care, which has 1 million outpatient primary care patients.
Wow. But you might just be I'm thinking right now of a physician who's got 3 small clinics in Kentucky, probably struggling with the mental health needs of his population, wants to care for his community, and Valera Health could potentially be a partner for him.
Absolutely. We're not in Kentucky yet, but if we were in Kentucky, we would absolutely work with that person.
Awesome. Very interesting. All right.
Yes.
Lauren, always great to hear the latest and greatest. Really excited that Valera is growing and thriving, adding on this credentialing piece, which is so important to the workforce challenges.
Yes.
And I'll be excited to hear your updates next time we meet.
Yeah, thanks, Logan. Thanks for
right.
having me.
Thanks, Lauren.